especially with the lockdowns and all of this. It's a mess, and we're here to talk about it. But for me, it's a very bad picture.
It's a mess. Dr. Joseph Serwadda is very much more worried. When I come to you, Sheikh Wasiwa, I was in Uganda a couple of weeks ago, and Uganda is one of those Muslim strong areas. From your perspective as Deputy Sheikh, and I am so grateful that you're the center of having these conversations with the people. Why is it important that we prioritize adolescent health in today's age?
Well, prioritizing adolescent health is indeed the prime responsibility of every household, if not the nation.
Nice.
Without which things will completely go wrong. Because the adolescent health of today are the responsible individuals of tomorrow. They need to learn from us, have a practical and model example from what we do, so that they also emulate and practice similar responsibilities in their lifetime to come, in their responsibilities to come. Therefore, adolescent health is a prime responsibility because this is an age of confusion, age of not knowing exactly what to do, age of venturing throughout. You can see a baby right from babyhood. When the baby sees an insect, the first thing she would like to test that insect.
To eat it.
To eat it, possibly. Anything that comes across it. So that attitude goes on up to the adolescent, that they wish to know what is the truth of life. What should they do? Therefore, they are in urge to learn from us what is the right picture that they should be able to emulate and be able to practice in life to make life meaningful.
Wow. I love it the way Sheikh Wasiwa puts it. He says that to emulate, it means that we have a rule as a countrymen and women to give the best example the adolescents can pick on. Dr. Serwadda, now this brings me back to you. Where do you think we have gone wrong as a country, and how best can we possibly change? In this regard, I don't want to say what should government do, but I want to take it kwa ujumla as a country. Where have we gone wrong, and how do we fix it?
I think different things can be done. One is to study the very situation, the state of adolescence in the country. That study needs to be done.
Nice.
And if you're going to exonerate government, I'll come back to that. But let us do a study. What is the HIV rate of adolescents in this country? Today it stands at 9.1%. That's very high. Number two, you got to look at teenage pregnancies, childbearing, early motherhood. That's pretty very, very high. It stands at 25%. So these studies have not been made available for people to know what is happening. Thirdly, 25% of all the maternal deaths are linked to unsafe abortions and due to teenage pregnancies. None of these studies are made public by anyone. So let us do a study, and I can go on and speak until evening, because this is where we are.
So we need data.
We need data. Study. Number two, we cannot exonerate anybody. The religious people are doing their part, but that's all they can do.
But now you did it.
You cannot walk away from saying government should do this. I think government should be up there on the forefront, and they should increase availability and access to adolescent-friendly health services.
adolescent-friendly health services.
They should be there.
That is critical.
They should be the ones teaching these young people, when you have an issue, here's where you go. There's no information like that.
Oh, yeah?
You don't go to any hospital and see anything set aside for young people. Number two, and of course with the follow-up on that, what is the information that government is giving out on HIV/AIDS, on condom use and all of that? Even now, as we talk about COVID, the first message that came out was, young people below the age of 20 don't even need to worry about anything, because when COVID catches them, they fight it off. The immunity is stronger. The immunity is very strong. The immunity is very high, so they are safe.
The Serwaddas should be worried.
It is the Serwaddas who should be worried. Now, if you're above 45, 55, you are very vulnerable. Very much, okay? But has that been changed? No. In our nation? No. And yet in other nations, yesterday, the US was reporting that they are getting more children hospitalized
with COVID.
More children. They're not even, they're actually talking about babies. 2 years, 3 years. COVID. And in Uganda, we still hold on to that old thing that happened about a year ago. The immunity is very strong. So there's nobody talking. Government should be there. Secondly, I think government should create safe spaces where parents, caregivers can easily communicate to adolescents about delaying sexual relationships and activities, avoiding these things that we are now seeing the World Health Organization pushing. For example, WHO is saying, if you are a smoker, stop it. But who are they talking to?
The target audiences.
They are talking to everyone. We should be talking to people.
We should prioritize the clusters we're talking to.
Exactly. Because who are the biggest smokers in this country?
They're the youth, the adolescents.
The young people.
They're learning.
Yes, they're testing it out. They're learning. They're picking up habits and ways of living. And that, to me, is pretty dangerous. Finally, I can see that we need to prioritize reproductive health in the national budget. So you can't get government out. They're not even talking about it. They are not talking about any funds set aside for this particular section.
Actually, when you come to think of it, we have taken at least like 4 months or more without any advert talking about reproductive information.
Exactly.
It's all about COVID-19. It's all about the preventive measures. It's all about, and the media is actually drumming a lot of scandals that are engulfed in the COVID.
Yeah. And I am in the media.
Is silent.
I'm in the media, and I can tell you why the media does what they do. It's just to wake her up.
Oh yeah.
It's just to wake up government that you're not doing enough in this area. Look at what's happening. Look at what is happening. And so that government can now walk away from its traditional way of communication.
The message.
And go to the media and buy airtime and talk to the people. And the government thinks in terms of a select group, a small clique of media houses.
They are dealing in silos. It should be a holistic approach.
It should be a holistic approach. Everyone should be at this job. They should be buying airtime and prioritizing. Because you see, when COVID came and the government locked down the nation, the first remedies they could think of were, number one, if you want to attend to church, go to your TV station, go to your radios, use your social media. Having forgotten that prior to that,
there was no
social media had just been closed down. Up to now, some sections of social media are not operative in this country. Okay, so now, when you tell people go there, where am I going?
Disoriented approaches.
You say, I'm going to speak to people. People who speak English and in this
the elite class.
Who are you talking to? You're talking to people in Kampala.
12%
you're talking to some people in Jinja, a bit of Uganda, and from there Mbale, you need to skip and jump to Mbale. Then you go to...
Then what becomes of the ones who've skipped?
Yes, it's Masaka. and Mara. You are talking to an elite class. You are not reaching out to everyone.
The usual people.
Very poor job.
Sheikh Wise, so now this brings me to this. He has alluded to something that the national budget should actually prioritize and give particular funds to reproductive health to their adolescents. You as a religious leaders, especially from the Muslim perspective, how can the National Fund help in promoting adolescent health?
Well, this question can be translated into collaboration between the agents that are very eminent in this, like the government agencies and the religious organs, the faith-based organizations, the health centers and hospitals, and then they all have to come together with a plan of collaborating together, of working together to put this into action in order to help the adolescent health benefit out of this kind of situation. Also, these agents need to bring out the concerns of the adolescent health. Like Doctor was putting it right. You see, the concerns of the adolescent health are not really addressed in the widespread community. Beginning from right away the government, it ought to strengthen this, because what we see today is a broken families, broken bonds of families. Families are broken totally in terms of morality, in terms of practical model examples that they should render to the adolescent people. The families are now more engaged in material things of their survival than actually doing the obligation of rearing the adolescent, the upbringing community into the reality. You see, as the doctor puts it, indeed the study is very important, but addressing issues of family bond is also equally important. Critical. Because families have been broken. And what can help us in this regard is people to know what things can help the family to remain strong and work together. One very major thing, one major component in this is communication. Communication is something that really is very much missing out in our families. You see, parents want children to do good things, but the way they inspire this is through instructions, through orders, as if they are building an army.
In the barracks.
You see, they cannot inspire them through kindness, through close relationship. Actually, parents are never close to their children.
Yet they should be close.
Yet they should be closer.
Now, Sheikh, that brings me to another topic here, rather another context to your conversation. What are you as religious leaders doing with your structures to make sure that this information is cascaded down to the adolescents, even in the wake of the lockdown? I understand at the district level, at the parish level, as Muslims, you have structures, the Christians have the structures. Even in the wake of COVID-19, how are we cascading this information that they go down to their peers and they tell them, oh, and you need to maintain it. How are we getting that information?
That's exactly what we have done. We train our clerics, we engage our clerics at different levels. We publish some materials that serve as guide for these clerics in order to be able to address the issue uniformly. We engage the communities through physical meetings and also through the media. We also try to render counseling services. Counseling services are very important across different ages, but beginning, of course, with the adolescent age, which is very important. So we go on practicing this, monitoring it, but ideally, we require support in that direction because as religious institutions, we have limits that cause us not to reach far.
Oh.
Yeah.
Well, on Twitter here, you'll bear with me. While we're having this conversation, I tap into the ones online. Malumba Matthias says, a very great morning. Thank you so much for having this conversation with the clerics, and I'm grateful that they're talking about reproductive health. Now, my question is, back in the day, Dr. Serwadda, we had Glovimo, we had the True Love Weights, we had the PKs. All these agendas were geared towards having a youthful adolescent who knew their reason of living and purpose. What happened?
Well, I thank you, Mr. Mulumba, for the question. Nothing happened. Nothing in the negative happened, except, as you heard the Sheikh say, we are hindered, our efforts are hampered by lack of financing.
Okay.
That is a big, massive issue.
Okay.
When the government wakes up and says, what programs do you have? What you had, Glovimo, was the glory of the virginity movement. That was ours. When you had PK, that is preachers' kids, that was ours. Our efforts.
They're most vulnerable, by the way.
Yes. So nothing happened.
We had the True Love Weights where people used to come to
True
school.
Love Weights, that's ours.
And we wrote
It's
those
not
chicks.
government property. Government has no claim on those.
Oh, yes.
And there is a lot more. So, but the point here is, there are things that, and I'm glad that this program is coming on today.
On the Youth Day.
Today is International Youth Day. So when we talk about these issues, it's a concern that comes out of our hearts, out to the community to say, our children, for you, you have classes and you call them adolescents, you call them youth. You have those soft, nice, beautiful, technical words. For us, they are our children.
True.
Even if they are 18 or 19 or 20, they're still our children. Now, there was a time when the girl child was the big word.
Oh, yeah.
And you forgot about the boys. Now you're finding out that the boys are as vulnerable as the girls were. Okay. Secondly, efforts therefore must be made to make sure that both boy and girl are protected against anything that attacks them in this time. Let's look at some things. Girls and women, even during the COVID, the lockdowns and all of these other limitations, have been raped.
Gender-based violence is
suffering in quiet.
Exactly.
Nobody's talking about it. And nobody's discussing it. They are beaten, they are sexually molested, they are physically abused, and no one is bringing out these issues except in a mocking way. Yeah, for example, when you see a young girl, 15 or from 15 to 20, maybe 20 years. I think the one I saw on the media was a 20-year-old girl fighting with her mother over a man.
Abomination.
And the question was, why did he leave you to come to me? This is a young girl asking.
Really?
Yes, it was
Very
on the
disturbing.
Okay, so I'm saying that COVID has just made a very bad situation.
So, Doctor, how do you then protect the women and the girls from the gender-based violence and all this kind of conversation that are very negative in our communities?
Well, number one, I think, is enforce laws that protect girls and women. Enforce them. Make them active. Work them. Take them from the book to the street. Enforce these laws.
Nice.
Secondly, I think what we can do is support victims of violence, victims of this social injustice, to actually access justice, to go to court and be heard. Well, I'm not saying that everything is correct, but in America, And in Europe, before you go to court with a girl or a woman over any matter, they got 20%, some even 40% of the case already in their hands. So once they accuse you, you are competing over the 60%.
Chances are you're going to lose.
Chances are that you lose.
The support structure is there.
Men keep away. Even if you're very angry, you can never push, box, or do anything. You can never speak rudely. Never.
Because the laws are respected.
You can never start because the laws are strict.
Well, that is a conversation we're still having. Rashula from Koboko, my colleague, I can hear you very excited about this, that the men of gold at the different levels are addressing this. Rashul, can you kindly paint for us a picture of what the Youth Day celebrations are like in Koboko where you are?
See, sure about that.
Rashul? Well, I'm struggling to get Rashul, but I'll be getting him a little later. It's a conversation we're having. It's about reproductive health and the adolescents in this country. I'll take a break for now, but the hashtag is Morning at NTV. What you drop on Twitter, I'll pick it and I'll ask the leaders here and they'll answer it. We take a break for now. Good morning.
You're watching Morning at NTV.
Daily Monitor brings you an exciting experience with the e-paper this season. Subscribe daily, monthly or quarterly and win lots of prizes like branded items, TV sets, StarTimes satellite dishes, airtime, data, power banks, children's tablets, MiFis and many more. Visit epaper.nationmedia.com/UG to subscribe and be part of the promotion. Daily Monitor. Truth every day. Terms and conditions apply.
I'm growing up, I'm growing into every moment.
Thanks, Mom.
Nurture the moment with Minute Maid Delight, global #1 juice and juice drinks brand.
Founded in May 2003, National Forum of People Living with HIV/AIDS Networks Uganda, NAFOFANU, is an umbrella organization that coordinates networks of people living with HIV covering over 135 districts in Uganda. NAFOFANU, with support from UNAIDS, is building resilient people living with HIV structures to access HIV, COVID-19 services and information, with specific emphasis on people living with HIV, key populations and vulnerable populations. Join our panelists in a live talk show titled People Living with HIV and COVID-19. What do you need to know? Scheduled for Thursday, 12th August 2021 at 11 a.m. as they articulate the effects of COVID-19 on people living with HIV, importance of adherence to antiretroviral therapy, how PLHIV can ensure continued access to antiretroviral therapy, COVID-19 basics and vaccine information and uptake. Panelists include Dr. Stephen Watiti, Board Chairperson, National Forum of People Living with HIV/AIDS Networks Uganda, NAFOFANU, and Dr. Alex Muganga Mganzi, Head, Health System Strengthening Department at Infectious Disease Institute and Board Member at NAFOFANU. Sponsored by National Forum of People Living with HIV/AIDS Networks Uganda, NAFOFANU, with support from UNA.
Next Innovation with Japan Accelerator Uganda program Ninja is here to support businesses earning approximately $50,000. If you are ready for the next level of growth, apply via www.ninjajica.co.ug before August 22nd, 2021 to gain business support and stand a chance to access proof of concept funding of up to $18,000. Brought to you by the Japanese International Cooperation Agency, implemented by the Innovation Village, Hive Collab, and Outbox. Ninja Jica, transforming Uganda's startup ecosystem.
On the next episode
is brought to you by.
On the next episode.
I was not expecting you. Tell me, is Nina with you?
No. The other day we weren't able to talk because of her. That's why this time I came alone. I need to talk to you about us.
My love, I bought you a ring as our symbol of a new commitment.
No.
I'm not going to accept that, Eric.
But it's for you. I bought this ring for you because I love you.
Listen, just as you were honest with me and you made a fool of me and you said to me I'm in love with another woman, well, just like you, I'll be honest with you too, and I have to tell you that I don't feel the same way, that I don't love you.
I want to give Elijah an opportunity to win my love.
No, you can't just give up the love you feel for me.
Stop. I already did, and you should do the same. Try to recover your marriage with Nina.
Julia.
Try to.
So are you happy with your apartment?
Is brought to you by
ITEL, enjoy better life.
Okay, a very good morning to you. What I can bring up is that looking at this the program that was initiated by the President of the Republic of Uganda with main aim of empowering different categories of people. When you look at this particular program, 18 categories are supposed to benefit from this particular Emyoga program, or 18 circles, which includes also the journalist circle. Last week, the Speaker of Parliament directed the members of Parliament to come on ground and supervise this particular government program that is so far in its second year of implementation. Now, for the case of Koboko, a total of 869 circles have been registered in this particular program, with a total of over 1,560,000,000 received for the circles. Now, yesterday during the visit by these members of Parliament in the different constituencies, for the case of Koboko, we have 3 constituencies. That is the Koboko Municipality, Koboko County, and then we have Koboko North constituency. Now, yesterday during the visit by these members of Parliament, the beneficiaries of this program are complaining that the money given by the government is not enough, looking at the number. Now, when you look at the guideline says in a circle, at least there should be around 30 members, and the maximum of associations within a circle should be around 5. So when you look at the 30 million people are complaining that having around 5 associations within the same circle sharing 30 million is not enough. And then also the other issue that I was able to find out on ground when these members of Parliament visited the different constituencies, one of the issues is people are complaining about the bureaucracy. When you look at the way these monies are being accessed, they're saying the bureaucracy is too long. Sometimes you find that people give up on the way due to long channels that you are supposed to follow before accessing monies. Some of them said they started this program, struggling for this program long away last year, but up to date, they are not able to access this that have come up on ground. But however, the members of Parliament have also played that some of these recommendations by these people or the beneficiaries, they'll be in person to present before the floor of Parliament and also present before the necessary committee, also the finance committee. So the team is supposed to do with this particular engagement or the supervision and monitoring of this program today. Today they'll be in Koboko Municipality where they will finalize this particular program. And NTVs are on spot to follow each and every development that goes by as the members of Parliament continue to follow this particular Emyoga program that was initiated by the President of the Republic of Uganda. Now, Andrew, before I go off air, when you look at the government tried to come up with different programs. One of the programs that the government tried to come up with, we have the youth livelihood that also Koboko managed to benefit on. We have the web that aims at empowering the women, and also we have Operation Wealth Creation. Those are some of the programs that government tried to come up with. But however, when you look at the performance of these programs, in some of the districts, the performance has not been good. When the community is given this money, sometimes they end up becoming defaulters or they don't pay back these monies. So we have to see what will be the outcome of this particular presidential initiative on wealth and job creation, commonly known as EMIOGA. Andrew, that is the latest development that I can bring from back.
Rashula, we are hoping that we find lasting solutions to these, but please keep your eyes on this money. Make sure that it actually works for the youth in the area, and please wear your mask and stay safe and stay healthy. Well, that is my colleague from Koboko. With me in studio, I still have His Eminence Sheikh Ali Wasiwa, the Deputy Mufti of the Uganda Muslim Supreme Council. But not only that, he happens to be the Vice Chairperson Board of the 3FHI, and Apostle is our champion and implementing the AAR project in Namayingo. Not only that, in partnership with the Faith, it's called the Faith for Family Health Initiative. The conversations we're having. Earlier on, we had a comment that came in from Melanie on Facebook. Watching. Thanks, Melanie. Melanie said that Dr. Serwadda, when you talk about the silence, women and the girls suffering in silence, she said that the girls in the mass choirs, the worship teams in the churches, are being used by their team leaders, and they're suffering in silence. They cannot even speak about it. What's your comment on that?
Mass choirs?
Mass choirs.
They've not been operative for a year and a half.
Maybe, but it doesn't take away the vice that it has been happening.
Well, if it is mass choirs, then there are Matari groups. It's religious groups. If the attack is there, religious groups, where you find people coming together, when you find human beings coming together, temptation is very high. And anything can happen. Depends on the moral structure of that organization or the controls that are in place. May I say that it is possible for these things to be happening. I have no doubt that they are happening. But the point is, why don't they talk about it?
They're scared. There are no structures per se. If I'm looking at this
culture, Uganda is not allowed to say so and so. Andrew attacked me, or Andrew molested me, or Andrew this. Is it ours? Do we live in a cocoon somewhere where we are not allowed to say something? Serwadda did this to me.
I think
a pastor approached me in an appropriate way.
I think the fear here, Pastor, is, Dr. Brother, it's that these people hold a lot of clout in our religious dominions. That coming out and you say that the head of our worship team did this to me, first of all, no one is going to believe you, maybe. Have we provided structures where the teenagers and the adolescents within our dominions can come and say, so-and-so did something this to me, and they're going to be given the support they need?
May I say that by the time you are in a church choir, you've come to a point where you know some things at least. You've not just been taught music. No. Even if you have a natural talent. But you've come to a point where you are mature, you are part of an establishment, you are part of an organization, and you are part of this section of that organization, in this case a choir. I think you should be responsible for your life. Women should be allowed to say no.
Nice.
Women should be bold enough to say no. And men too. People don't even think
that men are harassed.
That's
true.
In the Bible, a young man called Joseph was harassed day in and day out by Potiphar's wife. And for refusing to sleep with this woman, he got 13 years of prison for a crime he never committed. 13 years. So men are as vulnerable as the women. So nobody should say the choir. Somebody could be... Don't we have choir mistresses?
We do.
We do. So what about if the choir mistress, the chief choir person, happens to be a woman and looks at me with a bad eye?
I need to go and say...
So that you need to go to the pastor and say, I'm going to walk out of this choir. I think
the eyes are not godly.
She is not.
On Twitter, Badlu Patel says, Sheikh, today's parents do not even beat. Those of us who grow from the Silipa generations, pulling ears and running out of the sitting room when parents return, calling parents sir, had respect and fear came in the same wave. And he goes ahead and say, how can we fix that? Then Namanya, rather Amanya says that this, what you said is 80% true. Parents need to change their approach to their children. But then again he asks that, why do you think parents are detached from their adolescent children?
Well, there are so many reasons why parents are away from their adolescent children. You know, the education system in our country, previously, before the civil wars in our country, the mode of education was day scholars. Many parents were in for day schooling, but because of rampant wars in the country, people chose to go for boarding schools, and the culture of boarding schools took over totally. Now the time that parents spend with their children is lesser than the time they spend in schools. So that's a very, very important important point that really detaches the parent from their children. Also, we need to understand that we parents also need to learn a number of things pertaining to the time of today, because during those days, as Patel says,
sleeper days, of course, there was no much exposure to so many things. But with the globalized situation, parents need to change the mode. You find children get more information than the parents. Indeed.
Ahead of the parents. So parents actually need to study to get to know how to handle the children in this contemporary situation. And of course, we need as parents to have assistance in this direction by those who know that they direct us how to handle the children a better way. And then we need to establish also how parents can easily understand the challenges of their children.
Easily is the key word.
It's very important. Otherwise, we are in we are not in the know. Parents are not in the know, and therefore it happens that they cannot render a service that is relevant to the concerns of the adolescent.
Wow. And this brings me now back to you, Dr. Serwadda here. Someone says you alluded to something called the casual. The adolescents and the youth are living a casual life, a casual sexual life, a casual, like they are so casual about everything.
Yeah.
He asks, how do we fix that?
One, and I think
that's a pertinent question.
I know, I don't. I'm trying to think through it. But here is where we go wrong. We think that parents are enemies. Every child that is growing up in our society.
At one time I asked my dad, are you my father?
the understanding, the feeling of a parent being the equivalent of an askari at the station is very, very pertinent in our society. But then the other one is also the evil that comes within a school structure and system. The religious people started fighting off this teaching, which came through a booklet provided by an international organization of the entire book was about sex, sexism, and all of that. And the desire is so that our education system, starting from kindergarten, there is sex education. We said, why don't you teach kids from kindergarten up to about primary 4 about hygiene, not sex?
So the mind is clear with sex, it's just hygiene.
Why don't you teach hygiene? Then starting from when they're about 12 or 13 or 14, and then you can start talking about those things. I think that. But why do you want to say sex education? toddlers, for kindergarten kids. Why do you do that? So the education system has been corrupted from the far west and just adopted wholesale into the Ugandan culture and the African system.
And that's we are casual.
That's one. That's why we are casual. Now, how many relationships are possible for a human being? That's a very simple question for a 10-year-old. And because they don't have an answer to that, they give them answers. Boy and a girl, they're talking about relationships. And we know the word relationship. We're not stupid. We know what it means. When you say boy and girl, boy and boy, girl and girl, what are you saying? You are actually, at the age of 10, teaching same-sex relationships.
That early.
And that early means you corrupt our children at an early age. By the time they turn to be 18 and they are mature and they are now beginning to take toll of their lives, taking decisions for themselves, they have already been corrupted. It's when people talk about corruption in this country, I am surprised that they go to Minister of Finance, they are talking about money, they're talking about budgets, they're talking about money. Corruption is in every fiber of Ugandan society.
The morals.
And for us, we are looking at those areas where the majority are not looking. And that's why we come here. For example, who told Parliament that the National Health Insurance Bill should not be passed as fast as it came?
They passed it as a contingency.
Why do you make it a contingency? They should have passed it. And even right now, it is before the president. And the president needs to be encouraged to now. May I say, Your Excellency, please, for Uganda's sake and for the future of our people, especially our children, would you please sign that thing and get it out of your desk?
As fast as possible.
It's the least thing you should even think about. Just sign it. Let our people get some cover, some insurance, some reason. We need health services. We need to change the status of health financing in this country. We need to change. May I give you an example, a quick one?
Just one, in a minute.
In 1 minute, I'll give it to you in 30 seconds. We lost one of our senior staff in our organization. And we had moved her from hospital to hospital. By the time we got the last hospital where she passed on, we had accumulated a bill of 90 million Uganda shillings. We're still fighting to pay that. There's no help from anywhere. I am wishing for God that had there been an insurance cover for her, she would possibly be covered by insurance. There is nothing like that. A man who supported one of our national singers, I think Eddie Kenzo or somebody, a man that supported him and gave him a car worth some millions of shillings, died recently.
True.
He left a bill of 450 million. What if this bill had been signed before? That would not have been a bill to the family. It is now a bill to the family. I'm saying that there is so much to say, and there is not enough airtime for NTV, for Dream TV or any other TV to give you all the time to say what we are loaded. We have booklets we've written, we've studied, we've gone to every detail, and we know that this nation is headed for doom should we not do something drastic right now.
Okay. Asha E asked and says, well, I'm grateful that you're talking about this. Let's talk about family planning. Dr. Serwadda, should adolescents be introduced to family planning methods, like the use of contraceptive, condoms, pills and all that? Or should we hide our heads in the sand and we just say, God will help us all?
I wonder why you ask a question and give yourself an answer. Because what you're saying is that if we do not discuss family planning, if we do not look planning for the family into the face, then we'll be burying our head into the sun.
Let's talk about contraceptives. Should the youth and teenagers be introduced to contraceptives?
I think it comes with religious feelings, so it's a very hard question.
And that's why I'm posing it to you. From a liberal perspective, though.
I'm also going to walk away from that. I don't want to be very liberal. I want to remain the man that I've been for more than 40 years. I am a spiritual leader, and I'm not going to say this is right, that's not right. But let's think about family planning. Why family planning? Why was it ever introduced? Are there no pros and cons for it? I think there are areas where family planning is at its valid and very valid. Then there are areas where it becomes very crooked and you think, what are these people thinking? So it really depends on who is interpreting which section.
And the context.
Well, yes. Now let me say, why family planning? In my mind, quickly, I'm thinking family planning affects everyone. Everyone in different ways. You think about human rights. Think about if somebody's sick, has a health situation, and they have to be careful how they reproduce. How many children can a woman have in Africa? Why did China say you can only have one child and then wake up and say, no, you are now allowed two? So these are two controversies.
Dynamics.
China is saying you can't have that many. Then they wake up and say, 3 years ago they woke up and said, no, you can have another one. Yeah, but the society here says, if my wife doesn't give me the children I want,
20,
doesn't matter. If she stops, I'll pick up another girl and I'll get more children. And you wonder, why do you want more children?
The dynamics.
The dynamics. Who is in the middle? The person in the middle is the Westerner who says 4 is good. Okay? That's the Western stand. 4 is good. But why 4? What's the rationale for 4? So you find that all the dynamics around this entire thing are very, very complicated. You need to do a thorough study.
Depending on the need.
Right. Talk about people who say, oh, Africans, high fertility, they are very fertile. Any woman that bring home will give you all the children you want. Now, it's this obsession with many children that kills the game. Why do you want many that you cannot afford?
Abaganda bagamba omwana omulambo gunyuma baana. You've heard of that saying?
Yeah.
So
you want your children to be there when you die.
Oh yes. Many of them surrounding your body, and they say, wow, Serwadda was such a remarkable man.
But do you see what you are talking about? You are talking about a dead man appeasing himself over people who are mourning and really very, very sad over his death. There are many, yes, but it caused a lot more sadness. So
it's very disheartening.
It's very African the way people think.
Because of time, allow me, Dr. Serwadda, go to Sheikh Ali Wasiwa here. The conversation we're having, it's about the adolescents and the issue that is arising in the COVID-19 pandemic. Sheikh, there is something. This week, I was here with one of the lawyers who's suing government for closing up the religious gathering centers. What is your comment about this? Because from the earlier submission from Dr. Serwadda here, he said that the religious gatherings and possibly the schools, these gathering centers, they were support structures that protected the adolescents in this way. What is your comment about the closing of the religious places of worship, and how best can we navigate it?
Well, learning from the first lockdown, we ideally witnessed situations that houses of worship were not ready to, to help. In reducing the spread of COVID-19. Actually, we found situations that infections were a lot more coming through sharing those gadgets that we do, coming from the toilets, the worshiping places, and so on and so forth. It was a reality. But later on, with the use of SOPs, and those which were developed by the houses of worship, in addition to those of the ministry, actually it reduced the trend.
Okay.
Now, in the second lockdown, that's why the concerns are, why should the houses of worship remain closed
for 60 days,
despite the fact that there is awareness in those houses of worship about the dangers of COVID, and even the SOPs that have been put in place in order to help in the reduction of the infection. So ideally, one cannot claim just to open without, providing a solution to the problem of the spread of COVID-19. It must go together.
The government approach and the religious approach.
And the religious approach. Yes.
Apologies.
Therefore, the concerns are that since other places have been opened, which gather more people than the houses of worship, with no control. In houses of worship, we can exercise control. We can limit the numbers. We can do a number of sessions and things like that, in order to maintain the spiritual intervention, which is really very critical and very important, without which we are seeing other consequences coming up.
It's true.
Yeah.
Dr. Serwadda, you comment on that.
I was going to say that this last thing you're talking about should have been the first one.
No, you see, you saved the best for the last.
Okay. SOPs.
Yes.
Let's start there. When government wanted to teach the masses on how to observe the standard operating procedures, SOPs, as we know them now, they approached religious leaders. We became centers of training and education.
Inclusion
I
key.
went across this nation teaching our bishops and our leaders, and I met more than 10,000 pastors personally.
SOPs.
SOPs. And churches and mosques and places of worship became centers of education on this one. So you think of what has happened to us. What will government... Oh, they are back. Have they repented? Are they repenting now? Secondly, let's think science. Science. When you say the scientists have advised, okay.
Even after we open, the churches will have to wait for 60 days.
No, hold on. Scientists have advised the president, and it's very clear. I've been advised. They think. He's not taking any responsibility at all. So we know it's the scientists. But you think of a man who is seated in the same bus from Kabale to Kampala for 6 hours in the same environment, seated in the same seat. How much dangerous is that to a man who sits close to, like now we are at least 1.5 meters apart. And that's why I'm not even wearing my mask, and I have a copy. I have a mask here. So if I go to place, once I step out of here,
you wear your mask.
But you think of somebody seated with you in the same bus, high speed, and whenever you try to open a window, air comes in, and that thing goes away from you to anybody else. And when you close the window, there's circulation of air. Is that science still? And you allow them to move, and you don't allow a worship center?
What's the way forward?
Hold on. Who go to these worship services or centers?
We the people.
You the people. You go to the market, you go to the stores, you go
use
to the
public
supermarket.
transport.
You use public transport. You are seated in a Kamunyi from Mbale to here. And then you go to church for 1 hour or 2 hours. And that will cause people to get sick. You cannot say worship centers are super spreaders. No. We say the market is a super spreader. It is business that is killing Uganda. The first case, the initial case of COVID in this country was reported to have come from Dubai. You don't go to Dubai when you're poor. And then all the subsequent cases were people traveling from Kenya, from Tanzania. Travelers. So now, where does Uganda get all these cases? Enter the second phase of the lockdown. Where did we get the variants? The first one was from India. India is not anywhere near Koboko. The second one was from South Africa. South Africa is nowhere near to Kabari.
It's for travelers again.
It's for travelers. It's for people who have the luxury of going to another nation and coming back to us.
Doctor, because of time, what's the way forward here? How best can we navigate this?
There is no better way if you have the wrong scientists advising a president. No, they are wrong now. They closed us for 42 days. We all agreed. They closed the churches for another 60. And they are now threatening that at the end of this month, which is very soon, there is going to be a third wave.
Coming.
That will mean close. So the churches are going to go an extended 42 days. So 42 plus 60 plus 42, that's 144, and plus another 60, 200 days. A whole year of inactivity. The desire of this government is to kill churches.
Wow, that is Dr. Joseph Serwadda. It's a conversation we've had. It has been an honor to actually have you, gentlemen. Thanks for your opinions. It was about the adolescents and how best we can navigate through. I had, of course, His Eminence Sheikh Ali Wasiwa, who is the Deputy Sheikh Mufti from the Uganda Muslim Supreme Council. He also happens to be the Vice Chairperson Board of the 3 FHI, and also that is Dr. Joseph Serwadda as well, who happens to be from the born again faith in Uganda. But not only that, he's implementing a project in Namayingo in partnership with the Faith for Family Health Initiative. This is not a conversation about just us in the studio. It's a conversation you, my fellow Ugandan, you need to tap into. Now, going to my other colleague in NTV, that is Ivan Kamana Walnyolo. I understand there is something burning. Ivan, if you can hear me.
A very good morning to you, Andrew Chamagra, and our audience. I am coming to you from the expressway here in Katavi Town Council, Wasiwa District, and we know very well that today it's an International Youth Day, a day when every youth has to be celebrating. And we know here back in the country, given the fact that there is going to be a national function that is going to take place in Kololo when President Museveni will preside it over as the guest of honor. And we know very well that, of course, the youth here in the country share common goals, given the fact that some of them, share political divides. Some of them are NRM, others are National Unity Platform, FDC, among other political parties, but it does not take away the fact that the youth share some common goals here. And here with me, of course, are some of the youth who are going to attend the national function that is going to be in Kololo, but some of them are not able to go there because we understand, given the SOPs to spread to combat the spread of COVID-19, a limited number has been selected. But I just want to pick their mind as they go for this function. What do they want to listen from the leaders? What do they expect the leaders to put on table? On my immediate left, I have Ibrahim Kazibwe, who is the NRM youth representative at the district. I also have Kayanja Luis, who is the National Unity Platform youth representative at the district. We also have Chikomeko Hassan, who is also a district representative here in NTV. And I just want to quickly pick their mind what they expect to be put on table when they reach Kololo. Let me start with Ibrahim. A very good morning and welcome to NTV.
Thank you, Ivan.
What do you want to listen when you reach Kololo? What do you want to hear from the leaders in regards to the youth interest?
We would request the president to add on the youth budget first of all, because we've seen a number of things that are being left out. Now, for example, we haven't been having councils ever since we were voted in office because we don't have facilitation to hold those councils. But I would also urge other youth leaders to look at other components and other ways of how they can combat and also lobby for the youths out there, because the most important aspect is the government has to add on something to the youths, and also us, the youths, have to decide on how our life should be. Because you find that we must decide, we must have the sense of urgency, and we also must have a decision-making skill. Because you find that 1% of the world, they own the world. They own the wealth, they own the politics, they own the music, they own the arts. Only 1% of the world population, they own the world. So you have to be part of that 1% instead of being part of those who say things are done.
Let me go to the Kikomeko Hassan, who is also an NRM youth representative here in NTV. What do you want to hear in Kololo? What do you want the leaders to talk about when they will be speaking to you, the youth?
Thank you, Mr. Ian. Thank you very much. Since you know that in
in Uganda, youth are 77% to the population of Uganda. We expect the president to add more money in the projects of the youth because they are the many. They are the people, they are the kind of people who have no jobs. They are the kind of people who need to push, and the president has to understand the kind of people he's dealing with. So on this issue, I really emphasize the president to add more money, also to create a team that will help these people, like these people to have jobs. Create, we want job skilling, we want people, youth from the ghettos, there are so many, they need help. They need help from the ground. Thank you very much.
Well, let me come back to Kayanja Louis. You're not going to be part of the team that is going to Kololo.
And why would I be there?
What do you want these people, what do you want the leaders to talk about while they are going to address the youth in Kololo?
Thank you, Ivan. This is Kayanja Louis. First of all, I would ask, what are the youth celebrating? Are they celebrating because they are poor? Are they celebrating because they have nothing in their pockets? 99 number of the graduates in Uganda here are jobless, have nothing to do. And in other words, their president is calling the fellow ministers, older people, more than 70 years, to sit and even have decisions for the youth. Have you really called, have you emphasized, have you talked to the youth and you know what they're really going through? What are they celebrating for? Maybe other countries out of Uganda, they can celebrate. We have nothing total to celebrate.
The two are saying that they're interested in the president talking about channeling more money into youth projects and making sure that the youth have representatives on all the platforms that discuss matters of national importance. Would you subscribe to their comment?
Totally, I would subscribe to it if at all the people who are going to be given that money, they will deliver it up the way it is given to them. But if you're calling the honorables, Nabanjas, the older people to have really to budget for the youth, how are they going to understand the things that we are supposed to do? There are a lot of things that the youth are going in. They are suffering. They are having totally nothing. Teachers are suffering. We have a number of teachers who are youth, but they're no longer even interested in doing those jobs.
Oh, that's a conversation that is still ongoing, and we'll tap into it in our subsequent bulletins. Stephen Mbide joins me in Antinda, where he is discussing the youth livelihood. Remember, earlier on we had the Myoga conversation, and now want to tap into the youth livelihood. Mbide.
Yes, good morning to you once again, Andrew Chamage. You know, I was telling you that for many people who are still at home in the lockdown, this public holiday, the one being the International Youth Day, is not really making a lot of sense for them because for them they're out of employment, and this is even worse due to the effects of COVID-19. For the young people who are commemorating the International Youth Day, of course we know that more than 70% of Uganda's population are the young people who are aged below or just 35 years. Waliwo Mvuka Gwensanze, he's just one of the young people. He's just busy here at the washing bay here in Ntinda. He's trying to make a living because he has to, of course, to survive. He's going to let me know and understand how he's finding life as a young person. If you can come closer. Good morning to you.
Good morning, sir. How are you?
I'm okay. What's your name?
Wafula Jime.
How old are you?
I'm 24. Yes,
how are you finding life as a young person?
You know, as a finding life as a young person is like, it's all about struggling. It's all about, and it's all about doing what? Taking a risk as a youth, as you know, because you know, as a youth, you must be focused in what you're supposed to do. That's
when did you start working here at the washing bay?
It's been 1 year now. Yeah, as I've been working. Yes.
But generally, we've been in lockdown. I guess, vehicles were not moving, even coming here at the washing bay. How were you able to survive and cope up with life?
Yeah, okay. Actually, as a youth, as I told you earlier, that you must be focused. You must mean what to do. Like an example is like, okay, though we have been in lockdown, but at least some vehicles, you know, as our president released some vehicles like essential workers. So at least you can walk. You can walk, at least you come and struggle. You cannot finish one day without washing one day.
Well, the government ekoze bulungi nnyo, ekoze kimala okuyamba abavubuka wateekerawo enteekateeka ezibayamba okubanga mwebezaawo mu bulamu bwammwe.
But the programs, programs government zileta na is like sometimes because government because is the problem is that what the leaders is like it's not easy to be reached. That's the problem.
Okay, generally it's not easy just to be empowered and come out, be wealthy, or of course have a decent living.
Yes.
Okay, thank you so much. You said the name is?
Wafula Jime.
Wafula?
Wafula, yeah.
Okay, thank you so much, Wafula. I can leave you, continue with your day's work. And he is one of the young people, many young people who are struggling and trying to do their best to live. But here, still in Tinda, there is a place that is also trying to cater for the young persons, enable them have skills, coping skills, and of course, help them to be able to cope up with life. One of the persons here is Ashraf Kakaire. He's the Communications and Advocacy Officer of Open Space Center, the people who are trying to work with the young people, just like him and many others. Good morning to you, Kakaire.
Good morning, how are you doing? And viewers on NTV.
First things first, today is International Youth Day. We know the theme is youth initiatives, youth innovations for transforming the food systems. Just brief us, just for now, how important is this theme for today?
I think that the theme came in at the very right time. Youth innovation for transformation of food systems comes in after a 42 days lockdown, where young people were at the front of asking for government to give them food. It's very unfortunate that 7 days in the lockdown, people started crying out for food. That means there are some important questions that need to be answered. In areas where we feel some people have excess food, but I think the way we store our food, the storage of our food, but also value addition into our food is also something that we need to look at. And if we are to transform the food system in this country, the young people should be at the forefront. So I want to appreciate people that framed this theme, this year's theme of the International Youth Day.
When you talk about the young people, we see many young people coming out in drones, coming from the rural areas, trying to come to the cities, do just odd jobs. That like Wafula here, we may end up getting like less than 10,000 a day. Yet, if the government and all partners invested a lot, maybe in mechanization of agriculture, putting more money into transformation and also value addition, maybe we would be getting young people like him be able to get more money out of agriculture.
Definitely. Looking at this theme as a focal person on sustainable development goals, I looked at the theme having like 4 goals targeting. Looking at goal number 2, which is zero hunger, and it's something that we need to look at and also work upon. So given the energies and synergies of young people, we believe they have a lot to do in as far as transformation of the food system is concerned. It is very true that young people think that agriculture is for people that failed. But I think we need to change attitude of young people to start looking at agriculture, agro-business as a venture that they can put their energy into.
Okay, looking also at the time that we are in right now, the time of fighting the pandemic, COVID-19, being through a lockdown, many people were just surviving because they were able to get the food, because Uganda is the part of Africa where we have a lot of food. But when you see, yes, there are initiatives, the government programs, what else can we, even as individuals, as communities, local leaders, can they do to ensure that, yes, we have these products on the market, we have strengthened and competitiveness? How can we do this as we go ahead and commemorate this day?
So I think there is supposed to be a deliberate move by, first of all, government, but also development partners out there to ensure that we focus and prioritize agriculture and value addition to our food. This is something that can create a lot of jobs for young people, but also there is also need to rechange and refocus on our agriculture education in our systems and institutions to strive focus on value addition, but also sustainability on how long and how best we can change and also transform our food system.
Let's also talk about Open Space Center. You working with the young people, specifically for someone who is just watching you and hearing about Open Space Center for the first time. What have you been able to do for the young people, and where and where do you want them to? What's the vision for the young people in Uganda?
Interestingly, we were part of the launch of the Youth Week that happened last week at the Media Center, and we promised to keep to ensure that we use this week to amplify voices of young people out there. One thing that we had focused on is to ensure that each and every young person in this country feels the International Youth Day and also understands that the day exists. This day was supposed to, first of all, recognize efforts of young people, but also we've been profiling young people that have done a lot of work so that we can be in position to celebrate them and also try to help others to do a lot of mentorship so that they can change.
Okay.
Yes, please.
Okay, and your final word to the young persons who are watching us now as they go ahead and commemorate this day.
To the young people out there, I think this is our time, and we need to make sure that we use our energies. And we are young people at the right time. Technology is on our side, the numbers on our side. Then we can do a lot to change and transform our communities. I want to wish all of you a happy International Youth Day. Thank you so much.
Thank you so much, Ashraf Kakaire, the Communications and Advocacy Officer of Open Space Center. This being the International Youth Day. I should also say, ng'omuganda bwagamba nti twekirizemu, if a young person believe in yourself, just go ahead and make this day. At least by the time we commemorate the International Youth Day 2022, you'll be sure that at least on that day there's something I started on myself, on my own, without even looking for any other government or whoever. At least you are, after 1 year, you'll be sure that yes, you believed in yourself and did something that is so positive for your society, for yourself, but also for your country, Uganda. We love Uganda because this is our country. As the young people, we have the energy and the potential to do that. Back to you, Andrew Chamagero, and of course, Stephen Imbido and Pepe Swetchuga have been here with Collins Muhwez, and we wish you also, Andrew, because we are a young person.
Very much so.
And a happy international.
Thank you. Thank you,
Andrew Chamagero.
Thank you so much, Stephen Imbido from Antinda. I really want to thank you for the energy, and I love the fact that he said that technology is on our side. As we're celebrating the Youth Day, I want you just to have a critical question you ask yourself. What is your why? Why should you be rich? Why should you be successful? Why should you thrive and become the best at your career? Ask yourself, what's your why? As we celebrate the Youth Day, the celebrations are going to be virtual, but from wherever you are, ask yourself, what's your why? I'll take a break for now. Rather, we are finalizing the conversation. I want to thank those who were part of the conversation on the digital lane, and you were part of the conversation from where we started to this particular time. My coffee was brought by Coffee City in Ntinda by Inspire Africa. Fine time, drop by, get yourself coffee. Not only that, tap into the coffee value chain. I'm Andrew Chamagero. Shortly after me, Farida Nakazwe is coming up with Mwasuza Mutia. Good morning.